All right, now we're going to talk about acid-base balance. Acid-base balance. Now, the major chemicals you have to remember are bicarb, hydrogen, and CO2. Now tell me something. Is bicarb an acid or a base? It's a base. What about hydrogen and CO2? Acid. Think of hydrogen and CO2 as being acid, okay? Bicarb's base, hydrogen and CO2 are acid. Now, the major lung chemical I want you to remember is CO2. Don't worry about oxygen right now. The major kidney chemicals are bicarb and hydrogen, all right? So in a minute, don't you tell me that the kidneys are about to start exhaling CO2, because you know that is not possible, right? There's only one way to get rid of CO2. What is it? Exhale. Exhale. In fact, if you ever want to affect the CO2 level, the breathing's got to start first, right? You've either got to increase respiratory rate or decrease respiratory rate to affect CO2 levels. Now, these chemicals can either make you sick or compensate. It depends on which imbalance you have. Underline the word imbalance. In respiratory acidosis or alkalosis, which organs are sick? Lungs. How did you know that? The word respiratory gave it away, didn't it? Yes. Well, who's going to fix everything? The kidneys are going to fix everything. And what are the chemicals the kidneys use to compensate with? Bicarb and hydrogen. In metabolic acidosis and alkalosis, which organs are sick? Okay, kidneys. And if they are sick, who's going to fix things? The lungs. And what is the only chemical the lungs have to compensate with? CO2. And CO2 is a what? Acid. Now, do the lungs compensate slowly or quickly? Quickly. What about kidneys? They're slow but efficient. Slow but efficient. How long does it take for a kidney to do anything? Or decrease respiratory rate to affect CO2 levels. Now, these chemicals can either make you sick or compensate. It depends on which imbalance you have. Underline the word imbalance. In respiratory acidosis or alkalosis, which organs are sick? Lungs. How did you know that? The word respiratory gave it away, didn't it? Yes. Well, who's going to fix everything? The kidneys are going to fix everything. And what are the chemicals the kidneys use to compensate with? Bicarb and hydrogen. In metabolic acidosis and alkalosis, which organs are sick? Okay, kidneys. And if they are sick, who's going to fix things? The lungs. And what is the only chemical the lungs have to compensate with? CO2. And CO2 is a what? Acid. Now, do the lungs compensate slowly or quickly? Quickly. What about kidneys? They're slow but efficient. Slow but efficient. How long does it take for a kidney to do anything? About 3 days. About 3 days for a kidney to do any compensation at all. Now, on the next page, let's talk about compensation. Now, the major reason that we compensate, y'all, is to get the pH back in normal range. The major reason we compensate is to get the pH back in normal range, because what organ doesn't like it when the pH is messed up? Brain. The brain doesn't like it when the pH is messed up. That's why with all 4 imbalances, if you're reading about them in a textbook, they'll always say a change in LOC with every one of them, because the pH is messed up. Now, let's look at acidosis, and I want to go down the metabolic column first. Metabolic, and you're going to see that I'm going to ask you the same 2 questions every time. I want you to get into the habit of asking yourself these questions. Metabolic acidosis. Who's sick? The kidneys are sick. The kidneys are sick, and who's going to compensate? The lungs are going to compensate. So I want you and your friend to fill in the next 2 blanks. Okay, I'm too acid, right? I'm already too acid. And the compensating chemical is CO2, which is an acid. So if I'm already too acid, do you want me to keep CO2 acid or lose it? Lose it. So my respiratory rate has got to increase to blow off the CO2. And the more I blow off the CO2, my PCO2 is going to come down. Now, when I say PCO2, anytime you've got a P in front of something, that means partial pressure. And that means that blood came from an artery. Partial pressure. Blood came from an artery, like with ABGs. Now, let's go down the respiratory column. Respiratory acidosis. Who's sick? Lungs are sick. So who's going to compensate? The kidneys. By retaining and secreting bicarb. Remember, bicarb is a base, so we're either retaining it in the blood or we're secreting it into the bloodstream. And we're going to excrete hydrogen. We want to get rid of hydrogen, get it out of the body, because hydrogen is a what? That's an acid, so we got to get rid of it because we're already too acid. Now, the bicarb on the ABGs is going to start to do what? Increase. Remember, we're retaining and secreting bicarb. So it's going to go up. But y'all, how many days is it going to be before you see any change on the ABGs as far as your bicarb? 3 days. Now, alkalosis now. Let's go down the metabolic column again and tell me something. Who's sick? The kidneys are sick because it's metabolic, right? That always means the kidneys are sick. Who's going to compensate? The lungs. So you and your friend fill in the next 2 blanks. Well, I'm already too alkaline, right? And the compensating chemical is CO2. Well, if I'm too alkaline, do you want me to hold on to CO2 acid or get rid of it? Hold on to CO2 acid. So my respiratory rate has got to decrease to save CO2. And as I save the CO2, my PCO2 is going to start to go up. Now, respiratory alkalosis. First question, who's sick? The lungs are sick. Therefore, who is going to compensate? The kidneys. It's always opposite of what's sick, isn't it? Okay? Now, we're going to excrete bicarb because I'm already too base. We excrete bicarb and retain, hold on to hydrogen because hydrogen is a what? Acid. And as we excrete that bicarb, the bicarb on the ABGs is going to go down. But how many days is that going to take? 3 days before we see any change on the ABGs. So that's compensation there, all right, just in general. And remember, we like to compensate because that keeps our body in homeostasis. We like to keep the brain likes it when the pH is within normal range. And what's normal pH? 7.35 to 7.45. Now, respiratory acidosis. Let's go through. Is this a lung problem or a kidney problem? Lung. And what's the problem chemical? CO2 acid. CO2 acid. Now, do we have too much or too little of this chemical in the body? Too much. Because I'm too acid, right? Well, how did this happen? To hold on to CO2, something had to happen with your breathing, right? You're either breathing too slowly, too shallow, or not at all. Too slowly, too shallow, or not at all. Well, who's going to compensate? The kidneys. If the lungs are sick, the kidneys do the compensating. And we've already talked about that. Now, an increased CO2 leads to a decreased LOC. Because if you're too acid, your pH is messed up and your brain doesn't like it, right? Right. An increased CO2 leads to a decreased O2. You see, they have an inverse relationship, CO2 and O2. So now I'm hypoxic. What are some early signs of hypoxia? Restlessness and tachycardia. Restlessness and tachycardia. Late signs, bradycardia and cyanosis. Bradycardia and cyanosis. Bradycardia and cyanosis. Now, y'all, on NCLEX, they want us to pick up on it way before they get cyanotic, right? Because by the time somebody's cyanotic, it's really hard to help them at that point. They want us to pick up on it when they're just restless and tachycardic. Now, it says treatment fixed the problem. Well, the problem was the breathing, right? Let's look at some things that could have affected the breathing. Well, what if I just got back from surgery and I've got a big mid-abdominal incision? Am I going to take nice, big, deep breaths just because you tell me to? No, because it hurts. So I'm holding on to CO2 acid, right? Okay. Then the surgeon may come in and put a binder around me to hold my incision together, which made it even harder for me to blow off the CO2. If you're giving me narcotics or opioids, anything like that, those kind of, for my pain, those drugs are going to suppress my respirations and make me hold on to CO2. So as far as treatment, you got to fix the breathing problem. You've got to do whatever you have to do to help me blow off the CO2. That's the name of the game, blowing off the CO2. Now, what is a drug that will help correct acidosis that we give IV? Sodium bicarb. Sodium bicarb. But y'all, did that sodium bicarb fix my breathing problem? No. All that did was make my pH happy a little while. That just made my pH happy a little while. It didn't fix the breathing problem. You need to be aware of drugs that decrease the respiratory rate. And when you see a restless patient, what should you think first? Hypoxia first. Think hypoxia first. Don't do like you've seen in the hospital sometimes, where if we have somebody who's real restless and bothering with all the equipment and pulling the sheets off the bed, that sort of thing, you may see a nurse that goes to the MAR and says, I'm going to see what he's got ordered, right? Yep, here it is. Here's some Ativan right here. Let's give it to him, okay? You come with me. Hold him down. Well, when you give them the Ativan, that really made things worse because that could slow down their respirations even more. So consider hypoxia before going to the drugs. In fact, on NCLEX, you stay away from drugs as long as you can. They don't like nurses that go around just medicating everybody. Now, on the next page, let's look at respiratory alkalosis. Think about the name. Who's sick? The lungs, because of the word respiratory, right? Now, who's going to compensate? The kidneys are going to compensate. We've already been through that. Now, situation. Let's say we've got a hysterical patient. Somebody that's just real upset about something. They're breathing way too fast, and they're telling you that they're just getting upset, and they're getting all dizzy, and their face is tingling, and then bump, there they go, out on the floor. Well, are we going to wait until the kidneys kick in? No, because how many days is that going to be? 3 days. You aren't going to say, stand back, the kidneys are about to kick in, right? Instead, you would have them breathe into a paper bag because that forces them to take back their CO2. So when you see somebody getting nervous and upset and breathing too rapidly, then you need to be in the business of keeping them calm. Get the paper bag before they ever pass out, okay? They may have to be sedated to slow down their breathing. In treatment, treat the problem. Is it hysteria? Is it aspirin overdose? That's a cause. You see, aspirin overdose, when you take too much aspirin into the body, that stimulates the respiratory center. So you got to figure out what caused it before you treat it, because it's not the same in everybody. Now, metabolic acidosis. Think about the name. First question, who's sick? Kidneys. And who's going to compensate? The lungs. scenario here would be DKA, diabetic ketoacidosis, or starvation. Y'all, with either one of those problems, the pathophysiology is the same. Okay? The patho's the same. So let's think about this. When you are starving, you break down what? Fat is what I want you to think of here. Yes, you break down protein too, but fat is where we're focusing right now. And when you break down fat, you produce what? Ketones, and ketones are just what? Acids. If you got out your Tabor's Medical Dictionary and looked up the word ketone, it would show a word this long, and then at the end it would say acid, okay? So ketones are just acids. We're having a buildup of acid in the blood because of the excessive fat breakdown that's occurring. Treatment, treat the problem, okay? Is it because you're starving yourself, because you have an eating disorder? Is it because you're in diabetic ketoacidosis? It just depends on what the cause was. Now, metabolic alkalosis, think about the name. Who's sick? Okay, the kidneys are sick, and who's going to compensate? The lungs are going to compensate. Now, the scenario that I always think of here is vomiting. Now, I want you to